A client who requires an IV is in need of vascular access for fluids or medication on an emergent, urgent, or planned basis. While there may not be an order that reads start IV or insert peripheral IV, there will be an order for fluids to be run or a medication to be infused intravenously. When this happens, the nurse will need to gain peripheral vascular access with an IV. Venipuncture is the insertion of a needle into a vein. Here we will review venipuncture for the purpose of inserting a catheter for a fluid or medication infusion. As with any procedure, be sure that you wash your hands before beginning. Following current CDC guidelines, it is acceptable to cleanse the hands with an alcohol-based rub. Non-sterile gloves are worn for IV insertion. Additional personal protective equipment is required if the client has any condition calling for additional protection. Many facilities have IV start kits available, which include necessary equipment. You will need a tourniquet, alcohol wipes or other gauze saturated with antimicrobial solution, povidone iodine wipe, gauze, transparent dressing, IV label, and connecting tubing. Many facilities use a needleless system that places a T-tube filled with saline on the cannula after the start rather than connecting the primary infusion tubing to the cannula itself. This provides for safety when changing tubing and allows flexibility if the infusion becomes intermittent. Prior to beginning the procedure, be sure to check the identification of the client and the medical record indicating the need for the peripheral cannula. Explain the need for venous access. Now is a good time to describe the procedure simply to the client in order to reduce any anxiety and ensure cooperation. Anxiety can cause a vasomotor response that can result in venous constriction, which makes the venous cannulation more difficult. When everything is assembled and the client feels ready, you will inspect the client's veins to find one that is suitable. Preferably, it is one that will rise above the level of the skin when the arm is held in a dependent position. You are inspecting for smooth skin, no sign of infection, no knots below the skin, and avoiding areas where there have been previous venipuncture. You'll want the insertion site to be naturally splinted by bone, and you'll avoid areas that are damaged by previous use, sclerosis, or phlebitis. Insertion is also contraindicated in an edematous or impaired arm or hand, or on the side of a mastectomy, burn, or an arteriovenous fistula. Choose a vein that is easily palpated and feels relatively firm, full, and resilient. It should also be large enough to allow circulation around the size catheter you need for the fluid you are infusing. And you'll want to select the client's non-dominant arm whenever possible. Selection of the catheter insertion site varies with the length of time medications or fluids will be infused, the age of the client, and the viability of the client's vasculature. The preferred site is the arm starting with the distal veins, such as the metacarpal veins. If successive insertions will be needed for longer-term intravenous therapy, the insertions will move up the arm to the cephalic and the basilic veins. When selecting a vein for peripheral IV catheter insertion, consider the type of medication or solution to be infused. For example, a large vein is best for hypertonic, viscous, or irritating fluids, as well as for rapid infusions. Although typically used for venipuncture to collect blood specimens, it's best to avoid the antecubital fossa for catheter insertion because that is an area of flexion and therefore inappropriate for an indwelling line. Place the client in a comfortable position with the arm in a dependent position to increase capillary fill. If the client's skin is cold, the peripheral veins will be less visible at the surface. Warm the site by rubbing the site or placing a warm compress over it for a few minutes prior to the insertion procedure. Once you have found an area that looks good to you, apply the tourniquet 5 to 6 inches above the proposed site and watch the vein's response. You should be able to palpate the vein through the skin, checking for its movement when touched, feeling the fullness of the vein with the tourniquet on. Check the radial pulse to be sure the tourniquet is not too tight. If it's not easily palpable, release the tourniquet and reapply it with less tension. Some nurses prefer to mark this site with a pen or marker. Release the tourniquet for the IV cannulation. Selecting the right cannula for insertion must take into consideration the purpose of the IV, how long it is anticipated to be used, the size of the vein, and the client's condition and cooperation. The larger the gauge number, the smaller the cannula is. An 18-gauge needle will allow volume to flow quickly through the vein, while a 25-gauge needle is suitable for a frail, older client who may receive 50 milliliters per hour. Remove the other supplies from the start kit. Fill the T-tube with saline flush, or be sure the primary infusion line is primed and ready for connection to the cannula. If the client has a hairy site for IV insertion, take scissors and trim the hair to skin level. Shaving can cause unseen skin abrasions and introduce pathogens near the IV site. Help the client to position the arm so that the IV insertion is comfortable and the cannula's position will not cause undue discomfort once placed. With gloved hands, cleanse the insertion site with alcohol wipe or other approved antimicrobial solution. Use a circular motion from the site to the area approximate 2 to 4 inches from the point of intended insertion. Let it dry, then cleanse the site with a povidone iodine wipe. Let this dry. It will take about 30 seconds. Avoid fanning the site and introducing any air particles to the area. If prescribed, administer a local or topical anesthetic, making sure the client is not allergic to lidocaine. Apply the tourniquet 5